Hi guys, thank you. I am not a clinician at CPC. I do community outreach, and I started on Monday, and I'm doing program supervising for the community outreach program, which is going to kind of address a lot of the topics you spoke of. Dana's one of our clinicians, and she can speak a lot more on the clinical piece. But I wanted to just kind of explain, I think that's a pretty good sentiment, what you were saying, and I think that goes from Seabright, and I work all the way to Union Beach. And it's the same kind of sentiment, is there's all these resources, and all these people need the resources, and how do we connect the people who need the resources to the resources? And there's frustration, I think, from the providers who have all this, and they want to bring it to the community, and to the community who needs it. And part of my role, at least with CPC, is to be networking with other providers like Catholic Charities, like Hope and Healing, like the MHA, but more importantly, networking with you guys. And my role, and when I came into CPC, what I explained to them I wanted to do is, we have all this, and the providers sometimes just talk to each other, but what I want to do is talk to the community and getting your opinions. Because what CPC is going to provide is mental health resources. So we have counselors who are here Monday through Thursday from 5 p.m. to 8 p.m. and on Saturdays and Sundays, but we're going to try to do a little bit more of by appointment. And so we have a 188 number, and we have flyers that say that. And the 188 number basically will link you right to an answering machine. Most likely it will be me who returns the phone call within 24 hours, and I will tell you what counselors are available. I'll make an appointment for you. You'll come see the counselor, and then you guys can work it out from there if you want to come weekly. We also have access to 8 hours a week of psychiatric. So for people who need a little bit more, for people who may have been on meds, who got disrupted from their schedule because of the hurricane, we can get you guys right back on track. So that's kind of where CPC comes in. We're also looking at doing a little bit of community building. So in the summer, we'd like to do some programs with kids, because we think kids have been definitely affected by the storm, and they might not be being reached out to enough. So it'd be very casual, very low-key for children, but give them a space to talk. And the other group that we're going to really be reaching out to are the elderly. And because there were a lot of issues of isolation, a lot of issues of depression, a lot of anxiety, whether it's because now they have to raise their house, and they might not be able to walk up a full flight of stairs to reach their house now, and all that anxiety. Or this was their network. I know there was a lot going on in the library, and they had this great meeting place to meet where that was their space, and now that space has been taken from them. So one of the things we want to figure out and work with them is, how do we give a space back to them? How do we create a new space? But the only way that's going to happen is from you guys. Because so what I'm going to do is, I'm going to be in Seabright as much as I can possibly, and the counselors are going to be here, and I'm going to reach out to the counselors to kind of get their feedback, but mostly it's going to come from you. And I'll make sure you guys all have my contact information, because any ideas you have, I want to hear about. And any knowledge you have, I want to hear about, because this is your town.